I'm going to do my presentation on a 64-year-old male that was admitted on 11/6 with left foot pain. Patient noted that his toes had turned black 5 days prior to admission. His heart rate on admission was 103. BP was 106/88. The rest of his vitals were within normal limits. On admission, his WBCs were 12.4, hemoglobin was 8.9, hematocrit was 28, and platelet was 412. He was admitted with a diabetic foot ulcer. Imaging of his left foot showed that he had osteomyelitis. A foot culture was taken, and he showed that he had extended spectrum beta lactamase organism. That organism was E. coli. On 11/6, when he was admitted, he received a metatarsal amputation. Prior to this, he was diagnosed with type 2 diabetes mellitus, chronic anemia, hyperlipidemia, peripheral artery disease, in which he received a balloon angioplasty on August 5th. A balloon angioplasty is where they insert a guide wire into the blood vessel. They inflate a balloon that opens the blood vessel and it restores the circulation. Past medical history included arthritis. He tested positive for COVID at the beginning of October, but now is negative. In June of this year, he was admitted with cellulitis to his left great toe, in which he received an amputation. In August, when he received his balloon angioplasty, the following day his foot was cultured and it came back that he had gangrene, in which he received another amputation of his toes. These two amputations, I believe, were related to the severity of his peripheral artery disease as well as to the gangrene infection. His most recent amputation on 11/6, I believe, was due to his osteomyelitis as well as his peripheral artery disease. From my physical assessment, he appeared thin, without distress. Facial symmetry was symmetrical. Apical pulse was strong and regular. No abnormal heart sounds noted. Radial pulse was strong and regular. No edema noted. Cap refill was less than 2 seconds. He had a saline lock on his right AC. He had a dressing on his left foot that was dry and intact. On 11/9, he had a wound vac placed that was draining red to brown drainage. I'm not sure the quantity of the drainage, but it was draining a good amount. His vitals were 110 heart rate. BP was 112/65. O2 sat was 100% on room air. Respirations were 16, and temperature was 97.5. He was alert and oriented times 4. He was happy about the election results. Pupils were round, reactive to light, and accommodating. Grips and pushes were equal and strong. Dorsal and plantar flexion on right foot was strong. Skin tone was brown. The skin on his legs was a little darker than his torso and his upper extremities. Temperature on his torso and upper extremities was dry and cool. On his BLE, it was warm and cool, or warm and dry, but no redness, edema, or tenderness noted. All of the surfaces were smooth. Skin turgor was less than 3 seconds. Patient had no bruises or tattoos, no lesions or moles. He just had a small scar to his right shin that was healing well. It was beginning to scab over. The hair on his head was black and beginning to gray. The nails on his hands were thin, pink, and smooth. The nails on his feet, or on his right foot, was pretty thick. They were kind of rigid and pretty yellow. Teeth were present. Mucosal membranes were moist and intact. Patient was able to do full range of motion for his upper extremities as well as his head and neck and his right leg. He had limited range of motion to his left leg. pedal pulse was, I wasn't able to palpate his pedal pulse in his right leg. But the nurse reassured me that he had circulation to his right foot. Respirations were unlabored, easy effort. Chest was symmetrical. Lungs were clear during auscultation. I was only able to hear inspiration, which were clear, but expiration were diminished. Patient was on room air. His abdomen was flat. Symmetrical bowel sounds were present. They were normal active to hyperactive. This might have been due to him just eating breakfast. No tenderness noted during palpitation, and the abdomen was soft. His last bowel movement was 2 days ago. He had a medium normal, and he was on a diabetic diet, and he was eating 100% of breakfast, lunch, and dinner. Patient was continent of urine and stool. Patient was using a urinal to void. Patient noted that urine was yellow without strong odor. And patient was using a bedpan to have bowel movements. Facial expressions, the patient was making eye contact, the patient was smiling. The patient followed directions, he was cooperative. Speech was clear and understandable. He had appropriate interactions. He was really pleasant to talk to. Hygiene was clean, he just needed to shave. His most recent labs came back and they were within normal limits, except his platelets were 128. Patient rated his pain at a 7 out of 10. He was receiving narco for his pain. Patient was receiving atorvastatin for his hyperlipidemia, insulin for his type 2 diabetes, ferritus sulfate for his chronic anemia. Patient was receiving aspirin, and I'm not sure how to say this medication's name, so I'm gonna call on Google. Clopidogrel. Patient was receiving clopidogrel and aspirin. I think this was related to him just receiving or having the surgery. They didn't want him to develop blood clots. Usually aspirin and clopidogrel are prescribed for people that had a stroke or a heart attack. They want to reduce the risk of them, having a reoccurring stroke or heart attack. So they prescribe these medications as like blood thinners. Patient was also on an antibiotic that I'm not sure how to pronounce, so I'm going to call on Google. Meropenem. When I Googled extended spectrum beta lactamase organism, meropenem was the first drug of choice. The patient received this medication IV push over 3 to 5 minutes. The patient's Mortis Fall scale was rated at a 60, and his Braden pressure ulcer scale was rated at a 15. From these assessments, I chose impaired physical mobility as a nursing diagnosis related to his most recent foot amputation. The patient was going to return to a skilled nursing facility. Prior to him being in a skilled nursing facility, he was at home by himself. He was divorced. He has 2 children that just graduated college. So he was going to return to a skilled nursing facility. The patient was a good candidate for physical therapy. And another nursing diagnosis that I chose was impaired skin integrity related to him having a high risk of developing pressure injuries as well as being a high risk for falling. Patient was bedfast, so he's at risk for developing pressure injuries. I believe that's it. Thanks for watching.